Other side, down. Leg lengths are off today, so the original issue which he came in for, which was disc, now the disc is doing better because his motion is better, but his pelvis is the issue now. Good news is that your bending is much better, okay? But now the pain is localized in this area here, and this, if you remember, this is called the sacroiliac joint. It's where your hips meet the tailbone, okay? So what I'm actually seeing is pretty significant discrepancy from one side to the other in your leg lengths. So we're actually going to go in and adjust your pelvis today and see how that feels afterwards, okay? Good. Up. Deep breath and out. You feel that, yeah? I'm going to do this. Good. And you're going to give me a deep breath, and you're going to blow it all the way up. Deep breath and blow it all the way up. Good job. Lie face down. And after the adjustment, you can see nice and level. Very good. Same, better, worse?
A bit better.
Good. Other side? Any pain with that?
Yes.
Okay, and down. So I'm going to go in here. Yes. Breathe. Yes. It's sore in here, and this is the hip supporter, so I'm just releasing it. A little bit on the inside, yeah, and that's the joint itself. But I'm gonna work on the muscle a sec, and we'll see how the leg is afterwards, okay? Breathe, relax. I know it's sore. I'm just gonna work on the area. Now, you've been icing here?
Yes.
Okay. I want you to start icing this area here, okay? Right in here, okay? Breathe. And out. And breathe. And out. And relax. Lift the leg high as you can go. Same, better, worse? Good. Okay, so we're going to use a little bit more intensity. Going to use the hypervolt on the area. Okay, so if this is too much, let me know. I'm just going to hit it for about 15-20 seconds. How are we doing? You okay?
Yeah.
Good.
Is it normal to go on one side?
Common, yeah. It's gonna, remember, there's a lot of stuff going on in here. Remember when you first came in, you could barely bend, yeah? You couldn't even bend forward, yeah? Now the bending forward is fine, and this area is a little bit of an issue. So it happens, yeah, it moves around.
So it's normal on the disc area, it's more on the pelvis?
Well, remember, there's more than one issue we talked about, okay? So that disc is what you injured just recently, but remember that prior stuff that was going on, so this is more consistent with this. But remember, when you change the way that you walk, you move, things like that, your body compensates, right? So different areas can kind of flare up, all right? We have to put out the fires as we go along, yeah? And go ahead and bend. And how's that feel now? Same, better, worse? Much better, yeah? So let's recap this, okay? So good news is the forward bending is improved. Before, the forward bending was restricted because the disc was popped back, okay? Now, on today's visit, you had pain, very localized pain, where the hips meets the tailbone. That's called the sacroiliac joint. So this is kind of consistent with the prior episode that you had a while back, okay? So I think that probably doing the press-ups create a little bit of havoc in there, okay? So it's time to stop the press-ups now because the disc has been reduced, okay? We need to just clean up the pelvis area and see. Now, no press-ups. This piriformis stretch, I'm going to show you how to do this. I want you to do this if you feel some tightness in the area, and I also want you to ice the area down. But your press-ups are good. You're good for now, yeah? Questions?
I still have this, you know, the reports when you stand, you see the discrepancies. And I saw it's still there. Sometimes I think it was more on one side to the other.
Exactly, and that's exactly what I talked to you about before with your pelvic issue when you first came in, right? So
I'm thinking, let's just order
the orthotics, yeah. This is something, so the patient has realized this, that what we had talked about way back, which may be a recurrent theme. Yeah, I think we talked about this.
You think this type of shoes is like good?
No, I think the shoes are fine. The orthotics will go in these types of shoes fine, okay? You can flip out the orthotics from shoe to shoe, And the neat thing about it is it'll give you the correction, right? Because what we're seeing now is consistent with your old issue, yeah?
I saw the pictures, small ones.
Yeah, I was going to talk to you after we cleared the disc, because that I like the way you're thinking, because that's exactly how we should be thinking, because the underlying mechanics, since this is now a second episode, granted it's been a while, but it's a second episode, it would make sense to address the underlying mechanics to try to prevent this from reoccurring. Because the right pelvis was blocked, it put that muscle into a bit of spasm and was tight, okay? Because it's a support.
Especially when sitting.
Yes, of course, because everything is tightened in a sitting position because the muscles are contracted, yeah? Lie on your back. Okay, so bend the knees. Perfect. Okay. Now, yeah. So let's start. We're going to start on the. Let's start on the side. We're going to cross over. Okay. So this is the affected side. Okay. You're going to grab behind the thigh. Yeah. Keep your head down. You're going to pull up. Okay. So you're going to take it up to the point where you just start to feel it. That's your hold point. Okay. There's no bounce. There's no boom, boom, boom. Okay. It's hold. 3 to 5 seconds. And relax, okay? You'll drop it down. You'll do the opposite side. You'll bring it up. And this side's not nearly as bad, yeah? Again, 3 to 5 seconds, and you'll drop it down, okay? You'll go back. Now on this side, we're going to try to get it up a little bit first. So you take it up to that point where you feel it, yeah? Good. Yeah, just to that point. So the point where you, this is it. That's your hold point. Don't exceed it. Hold that point, 3 to 5 seconds, and drop it down, okay? And what I want you to do is shoot for 8 to 10 on both sides, yeah? 8 to 10 on both sides, yeah? And we'll see how that is, okay? Okay, turn on your side. I taught you better than that. Come on over. Turn for me. All right. All right. One last time. Go ahead and bend forward for us. You can go. Hang with that?
No.
Yeah. Perfect. Yeah. So good. So I know. Yeah. Things look like they go. Minor tweaks. Okay. Do this. Stop the press ups. Continue the walking. How long are you able to sit for? Perfect. Okay, so that's a big difference.
It always feels like someone is holding my leg.
I understand. Okay? Yeah. No. I meant perfect as in it's increased. Yeah. How long were you able to sit before? No. Yeah, exactly. All right. So we talked about this. The sitting is going to take the longest. Okay. So just every 30-40 minutes anyway, you should be up. Okay. You might have to do the piriform stretch like 2 or 3 times a day, okay? I want you to walk, I want you to swim, no more press-ups for now, okay? Questions?
Yes.
Go.
For the disc, basically we're solving it by intensifying the muscles around?
No. The press-up is not for the strengthening. The press-up is to create a force to push that disc in, okay? Where you're going is, yes, the next step we have to do is we have to strengthen the muscles, okay? So the next step we're going to start is to strengthen stability. In fact, that's what I would have done today had you not come in with this little flare-up. So one of the things you're going to start to do, and I'm going to go over that with you briefly, because it's a good overall exercise, is something called bird dog, okay? But I want to see how this clears out. We'll go through that as well, okay? Questions?
Do you need to have an MRI to see the difference?
Yeah, I mean, like we talked about right now, okay? We can do an MRI. Probably not going to change based upon what I'm doing right now. We're like, what, 2 weeks into this now? 2 weeks or so, yeah?
This is the 15th.
15th, okay? So, well, when did you see me? 15th, okay? So yeah, we're still good. Percentage-wise, from when you came in to where you are now.
We estimate at least 70%.
So 75%, is the MRI going to get us the rest of the way? Probably not. I'll do the MRI,
No, just for
But-
us, I mean, to give the MRI input to...
Yeah, it's not gonna really change how I'm gonna treat this, okay? I already know you have a disc, okay? I treated you for a disc, you're 75% improved.
Yeah, it's only an indication, yeah, that's for sure.
Yeah.
But do you think in the
Future.
suspicious? Because everyone is telling me you're too young to have a disc.
Discs can occur, you're in the prime age for back pain, okay? 20 to 40, 30 to 50, this is when most patients have disc issues. Here's the deal. We do an MRI, you have a disc. So what?
No,
No. What I'm saying to you is, so what? You have a disc, yeah? Okay? You don't need surgery. You don't have many neurological deficits. We're going to treat it the same way. So other than make you crazy, oh, I have a disc, and that's the problem with this day and age right now, is we do all these tests, and whether or not they're significant, who cares, okay? Because the real bottom line is it going to affect the treatment? Am I going to treat the patient differently? And right now, based upon 75% improvement in 2 weeks, I'm not going to treat you any differently. Yeah, 2.5
No,
weeks.
that's fine, regardless of the MRI, it's a different topic.
Yeah.
We finish this treatment. This disc, I mean, the issue could be solved, and then you forget about it.
Okay, so what you have to understand is this. Back pain is cyclic episodic, meaning that the chances it can come back, okay? So, as you know, you don't wave a magic wand and it's going to go away forever. It's just not going to happen. What we want to do is we want to strengthen your back to the point where it comes back as little as possible. And number two is you can handle this. So instead of you were laid up in Lebanon, right? Had you known how to treat this, you could have done the press-ups and maybe that would have helped, yeah? That's the point is I want you to be able to manage this condition 95% of the time, 98% of the time without me, okay? So giving you the skill set and the tools it's like the best analogy I can give you is the flu, okay? Most of the time, you can manage the flu on your own. You don't need to go see the doctor. Exactly like that.
And then would I then be able to live in a small way?
Yeah, exactly. So I don't want you to live your life in a glass house, okay? Meaning, I fully anticipate you will be able to go back to what you did prior to this. I don't see anything from your examination that shows me any why, and you shouldn't even be thinking about that right now. There should be no thought in your head that I'm impaired, disabled, or not. You're young, okay?
Exactly.
But it doesn't mean that young people don't get back pain, okay? But in the grand scheme of things, back pain is 80-90% resolves in the first couple of weeks, and then the rest resolve in the next 2 weeks. So usually by a month, patients are better again. So,
Anyway, I will see the progress.
Yeah, that's good. Okay, all right, so let's go with this, yeah?
If I want to grab something, I go with my knees and
And this is
lesson
exactly, this is good, yeah? Okay, hands and knees. Okay, so this is called bird dog, okay?
Yeah.
So this is,
You teach me.
I taught you this, right?
Yeah.
So let's go through it. Do you remember it? Show me. Yeah, not bad. Good, you do remember. You've been doing this?
Yeah, I did it for 1 week.
And you stop.
And you told me to stop.
Okay.
Should I carry on?
Yes, you should carry on. Okay, now, one thing I want to point out. I want you to keep your back level. I don't want it to drop from side to side, okay? So, in order to remind you, I'm just going to put this on your back, okay? I want you to keep that level, okay? So just drop your back down a little. Yeah, perfect, good. And go ahead and opposites. Good. Other side. Good. Now I want full extension, okay? So go full, yeah? Good, and it's buttock high, yeah? No higher than that. Good. Other side. Good. So I want you to do these. I want now to start with these 1 to 2 sets in the morning, 1 to 2 sets in the evening, yeah?
Okay.
Okay. Yes. So this is one of the exercises that you're going to incorporate into your back care, okay? So whether it be you're going to the gym, this is part of your warm-up, or this is part of your cool-down, you're going to start doing this, okay? We're going to build now a strengthening program for your back and your core. Yep.